Hey guys, welcome to POTS Survival Guide. So I've gotten several requests for a video on POTS medication. So today we're going to be talking about my experience with POTS medications. So unfortunately for POTS, like many illnesses, there is no magic drug that will just make your symptoms go away. There are a lot of different types of drugs that different doctors will try for managing different symptoms of POTS. Some of the most common being Florinef, which is a steroid. Beta blockers are used sometimes, as well as blood pressure medication, among other things. So since I'm not a doctor, I definitely don't feel qualified to talk about the strengths and weaknesses of specific medications for POTS, because POTS is such a complex illness and everybody's case is a little bit different. So I'm only going to be able to talk about my personal experience with medications, but I hope that there might be something helpful that you can find in this video. So going into POTS treatment, I was pretty adamant that I wanted to manage all of my POTS symptoms, or as many as I could, as best that I could without medication, or with as little medication as possible. So for me, that was definitely just a personal choice. That's definitely not to say that I am anti-medication or that, I think it's inherently worse to try to treat POTS through a traditional medication. But for me, I didn't like the sound of a lot of the side effects I was hearing about. Also, my doctors were telling me that, these medications wouldn't actually cure my POTS symptoms. They would just sort of like mask them. Which meant that it was likely I would be on the medications for a long period of time. And I just really wasn't excited about that prospect. So I started by doing more of the lifestyle-based treatment, the sort of all-natural treatment protocol that I talk about a lot in my videos. Pushing fluids, cutting out processed foods and sugar, also supplementing with sodium and potassium, getting a lot of exercise as much as I could tolerate, things like that. And doing these all-natural methods, I did see a ton of improvement in my POTS symptoms, but I did eventually sort of plateau, which I know a lot of people experience. Really frustrating. So I did eventually decide that I wanted to do some short-term medication to just sort of give my body a little bit more of a boost. So I ended up taking small doses of Ritalin, which a lot of people don't know can be helpful in POTS. So Ritalin might not be effective for every type of POTS, but for me with hypovolemic POTS, I found it very helpful in just sort of getting over that plateau. So when you hear Ritalin, most people think of ADHD. But what a lot of people don't realize is Ritalin is also vasoconstrictive. So what this means is that it helps your blood vessels kind of tighten more. Which can be very helpful in hypovolemic POTS, because in hypovolemic POTS, patients have lower than average blood volume. And this happens in non-POTS populations as well. But typically when people become hypovolemic, their blood vessels recognize this and they tighten more to make up for it. So that way blood still gets everywhere it needs to go. But the current thinking is in hypovolemic POTS, the blood vessels don't constrict enough, so you end up, getting blood pooling in the legs and you don't get enough blood in the head, which can cause all kinds of problems and POTS symptoms. So Ritalin, as a vasoconstrictor, kind of helps your blood vessels tighten. So for me, it helps reduce my blood pooling. And it helped reduce the draining of the blood from the head, which caused me to get lightheaded when I was sitting. I couldn't sit through classes in school because I would just get too dizzy and faint. It also really, really helped me with my mental fog and like short-term memory problems, confusion, all of that. It basically was really what helped me get back into a regular school routine. So once I did get over that plateau with the Ritalin, I was able to get back into sort of my normal life. I was back in school, doing more activities, being more active. And it did come step by step. It didn't come all at once. But the Ritalin sort of gave me a little bit of a push that I needed to get there. So I did eventually taper off of the Ritalin, sort of once I got over that plateau. And I've been managing my POTS symptoms completely medication-free for a while now. So that's just what I did. But every case of POTS is so different. It's really important to get an individual plan for your particular body and your particular symptoms. I know Ritalin probably would not be very effective in hyperadrenergic POTS. I haven't seen any research on that, but for hypovolemic POTS, there is good literature to support it. But that was just what worked for me personally. You might find good results with Florinef or beta blockers or anything else that your doctor prescribes. Or you may be able to treat it completely medication-free. And if you don't want to be on medications long-term, sometimes just taking a short dose of a traditional medication like Florinef can sort of get you over the plateau, enough so that your body can tolerate the more natural methods of dealing with POTS. And eventually you might be able to get off the medication and manage your symptoms completely through lifestyle. So like I said before, I'm not a doctor. I'm really not intending to give medical advice, but I hope you found this helpful. In my case, it's just one of the many, many, many ways that people have tried to treat POTS. It happened to be successful for me. Maybe it would be for you too. But consult with your doctor, and I hope you found this helpful.